to Secretary Duque, having been Secretary before, PhilHealth President before, and now current Secretary. Was there ever, in the history of the Philippines, was there ever a product recall? Sa buong history po ng Pilipinas, nagkaroon po ba ng product recall na ang reason is lack of documents?
I'm told, Mr. Chairman, that there has been no product recall on the basis of deficient document submission, and that the basis for the product recall is actually findings of adverse findings on the product itself, directly concerning the product. So that is why you have the surveillance of these products, precisely to monitor through pharmacovigilance the status of that product once it has been introduced in the market.
So, Your Honor, ulitin ko lang po, ang sagot niyo po, sa buong history ng Pilipinas, wala pa pong produkto ang napra-product recall dahil kulang ng papeles. So this runs counter to what you were doing with the dengue vaccine. Moving forward, you also said that pwedeng mag-apply. May I know if the Department of Health is using the Japanese encephalitis vaccine?
Mr. Secretary.
Can I ask the program manager, again with the permission of the chairman, to please respond
Your
to
Honor,
the
it's
question?
just a yes or no eh.
I'm sorry, I didn't get the full question. I'm sorry.
Okay, let me recap. Sinabi mo sa buong history ng Pilipinas, no product was ever recalled because of lack of documentation. And the basis of product recall is the guidelines and the laws that abides FDA. Ibig po sabihin dito, hindi nagwa-qualify yung mga previous statements mo. Be that as it may, sinabi mo mabilis mag-apply 6 to 8 months. That's why I'm asking you, did DOH use the Japanese encephalitis vaccine?
Yes, Your Honor.
Okay. How long did it take for the Japanese encephalitis vaccine to be registered with the Food and Drug Authority?
Again, the program manager is requested to please
Your Honor, if I
respond.
may, it's not from the program manager. Licensing is with FDA.
I'm sorry, my mistake. It took 4 months for the JE to be certified, Your Honor.
Your Honor, I really respect the Department of Health. Pinko, you're a very good friend of mine. We've worked together. Pero hindi ko po malunok na sasagutin ako ng 4 na buwan because I have here the documents and I have here all the attachments. The vaccine was licensed within a span of 5 days. May I request for a few minutes suspension, Mr. Chair?
1 minute suspension.
May I request for a suspension to confer with the chair because while I do respect, I would really like DOH to move forward. Pero hindi naman po pwede na yung sagot sa atin hindi totoo. Kasi after all, how can we help the department? This is documented. It's 5 days. From the first day of submission to the issuance of the Certificate of Product Registration, Japanese encephalitis for DOH program. But now you're telling me it's 4 months.
This is what is being fed back to me by the FDA, Your Honor, because as Secretary of Health, certain operational issues are things that we don't get to closely monitor. And so my apologies if you have the documents. I will identify accountable officers to make sure that the information that is fed to me is actually accurate, Your Honor. Again,
Thank
my
you, Secretary.
apologies.
Mr. Chair, allow me to withdraw my motion to suspend consideration of the budget of DOH. Be that as it may, 2 sentences po. Una, sinabi ni Secretary Duque, walang product na re-recall sa buong Pilipinas because of lack of documents. Second, sinabi na rin that this will be investigated. Bakit? Kung pinapahirapan yung iba, bakit yung Japanese encephalitis? 5 araw lang from submission to issuance of CPR. Thank you very much, Mr. Chair, and thank you for your indulgence.